So just with that, so let's say, again, your heart's not pumping as well for whichever reason, patients are starting to develop symptoms of their heart failure. What types of things might they feel? How might they expect? What type of symptoms are they going to have?
For sure. And heart failure is a spectrum. So we talk about acute heart failure, and those are people who are coming in with symptoms. And we talk about chronic heart failure, where someone might have heart failure, but are completely well controlled and have no symptoms. So it is a spectrum. And Brody, you see a lot of the acute heart failure come into the emerge. And so do
Yep.
I in the hospital. But then on an outpatient, I'll see them 3 weeks later and they'll be perfectly symptom free. So it's really the acute heart failure and what we look for in terms of symptoms. And it is kind of anything that has to do with fluid overload. So essentially, because the heart can't pump all the fluid it needs to, you start to get fluid back up in the body. And the first place fluid can back up, depending on where the heart is affected, is the lungs. So if fluid backs up into the lungs, you start getting short of breath. And the more that develops, the more short of breath you get, especially with exertion. So when you're running around, walking around, or going upstairs, you might all of a sudden feel like, oh my gosh, I can't breathe the way I did 3 days ago. What's going on? With the fluid in the lungs, just purely because of gravity, often when you lie flat, like you're trying to go to sleep at night, the breathing also gets more difficult because that fluid is layering out. And you might even have some coughing at night because your body's just trying to get that fluid out, even though it can't. So there's special medical terms for that. You might hear things like orthopnea or PND or other things like that. But breathing issues are the big ones. And not all heart failure has that, but that is a really big sign that we see up front.